Ladies and gentlemen, thank you for your patience in holding. We now have our speakers in conference. Please be aware that each of your lines is in a listen-only mode. At this time, it is my pleasure to turn this conference over to Chris Hund. You may begin.
Thank you, Chantel. Hi, everybody. Welcome to the January TeamSTEPPS monthly webinar. This is Chris Hund from AHRQ in Chicago, very cold Chicago. It continues to be under 10 degrees, I believe, but we're supposed to get a warm-up. So I hope it's warm where you are or that it's on the way to being warmer. Today's webinar is Team Self-Correction to Enhance Performance. And we're very excited to have Kim Smith-Jentsch here today from University of Central Florida and other locations to talk to us about team dimensional training and how research into this can be used in implementing some of the TeamSTEPPS tools and principles. So, getting going here, I just wanted to thank some folks for being a part of this program. First off, the project sponsors, specifically Dr. Jim Battles from the Agency for Healthcare Research and Quality. AHRQ funds all of this work, and so thanks goes to them for that. Also would like to thank Heidi King from the Department of Defense. From the very start, DoD has been a partner with AHRQ in TeamSTEPPS and in all of the work around TeamSTEPPS, and Jim and Heidi have been involved in this from before there was a TeamSTEPPS, so thanks goes to them. The project team, as I said, my name is Chris Hund from the Health Research and Educational Trust. We're the nonprofit research and education arm of the American Hospital Association, and we do a lot of work on large national implementation programs around quality and patient safety. And so we're very happy and fortunate to be able to do this work on TeamSTEPPS and have been doing it for now. I'd also like to thank Impact International, specifically David Baker and Andrea Amadeo, who do a lot of work for the TeamSTEPPS project. Their expertise is always quite welcome, and they actually are in charge of setting up all of the webinars for this series. So the core of the TeamSTEPPS course is a master training course. It's a 2-day course that you come to at one of our 8 regional training centers around the country. It is a train-the-trainer approach where you not only learn about the fundamentals of TeamSTEPPS, but more importantly, you learn how to take them back to your institution. You learn how to coach them. You learn how to implement this, how to measure it, and so it's a very interesting course. I think it's a very good way to spend a couple days somewhere together with a team of your choosing to talk about how to improve teamwork and communication in your organization. What we also have available from AHRQ that I would like to also bring up now, if you can't travel, there is an online master training course that's offered by AHRQ in TeamSTEPPS. And there are several course start dates offered, and you can choose the one that best fits your schedule and work through the course at your own pace. So this is another option for you if you don't feel like traveling for a master training course. If you're interested, you can visit, the web address is https and then //tslms.org. And there's more information of this on the AHRQ website. And then you could also ask us if you're interested. We'll have the the email address and how to get in touch with us later on in this presentation. So some other upcoming events besides master training courses and the online course, we have continued monthly webinars, all scheduled through September 2015. February, we're going to be hearing from folks at the Metro Health Hospital and Health System in Cleveland, Ohio, about implementing TeamSTEPPS in their emergency department. So that will be the topic in a month. We also have our annual conference this year in Denver, and if you are interested in learning more about the annual conference and registering for it, you can hop on over to TeamSTEPPSportal.org to find out more. Here is how you get in touch with us if you have any technical difficulties or if you have any questions about TeamSTEPPS in general. You can use that email address, AHRQ@aha.org, if you'd like to learn more information, or to get that email address I mentioned for the online course. So, some rules of engagement before I turn things over to Kim. We will do a Q&A session at the end of this, but what we'd like to encourage you to do is to use that discussion area that you see in the upper left-hand corner of your screen. What we want you to do is write any questions you have throughout the course of this. If you have a question that's logistics or technical, we'll answer that question right away for you. If you have a question that's content-based, what we'll do is we'll grab everybody's questions and turn it into a Q&A that I'll be able to run with Kim at the end of her presentation. So this way, you don't forget what you want to ask. We can kind of order it into a kind of cohesive narrative of questions, and it seems to work well. The lines may open for call-in questions at the end of the Q&A session if we do have time, but we really would recommend that you put things into the discussion area. Okay, so today's presenter is Dr. Kim Smith-Jentsch. She is the Associate Professor in the Department of Psychology and the Director of the Industrial Organizational Psychology PhD program at the University of Central Florida. So I'm very jealous of Kim because it's obviously much nicer where she is today than where I am, but I'm really looking forward to hearing about her work on team dimensional training and how it all kind of can be used in tandem or can inform some of the TeamSTEPPS work. So I think you all enjoy this, and I look forward to hearing from you in the discussion area throughout the presentation. So, Kim?
Yes. Well, good morning, everyone, and thank you for joining us today. I'm very pleased to be talking today about a strategy for debriefing teams that I've worked on for many years, starting back in the early 90s. This is a strategy that grew out of some of the foundational research that was done on crew resource management in the early 90s. And this is one of the strategies that has been the most rigorously validated since then. So I'm excited to talk to you about some of the data that we've collected over the years. So I'm going to be talking to you about best practices for debriefing teams, and in particular, team dimensional training, which is a strategy that wraps up those best practices into a particular specific strategy. And I'm going to talk to you about the research results that show how TDT impacts learning and transfer of training, and then talk a little bit about how TDT has been leveraged to support team training in various other environments, including in conjunction with the TeamSTEPPS tools. Okay, so just a brief bio. I got my PhD in industrial and organizational psychology in 1994. After graduating, I spent about 9 years at the Naval Air Warfare Center Training Systems Division. Was very fortunate to start my career there because at the time, the lab that I was in was doing some of the first research, the very foundational research on defining expert teamwork, what is it, how to best train teams. And that was a great place to start my career. I transitioned over to academia in 2003. I'm currently the director of the PhD program in industrial and organizational psychology. And I have a number of grants from the Navy, state of Florida, and most recently from NASA. I also have a small consulting business that I do where I primarily develop and deliver leadership and team training of all different types. So if you're interested in anything like that, you can also contact me after the presentation. So as an overview, I'm going to start off talking about some of the background research what some of the questions were that we wanted to answer when determining how best to debrief teams. Tell you some of our lessons learned, what makes a debrief effective, and then step through very specifically team dimensional training and how that works. Talk to you about the benefits, and then give you some takeaways that you can apply in your own environment. All right, so post-performance debriefs are used both in training and to debrief incidents that happen on the job. What differentiates debriefs from other types of team training strategies or evaluation techniques is that they're developmental, they involve active self-learning, they're tied to a concrete performance event, either simulated or actual. There are multiple sources of information that are used to diagnose performance problems and to deliver feedback. And research that has compared training that involves debriefs versus simulation that does not include a debrief has shown that on average, learning is improved by 38% when using a debrief. So we know that debriefs are important, but we also know that not all debriefs are effective. And one of the first projects that I worked on after graduating was to investigate debriefing. I traveled around different Navy sites as well as outside of the Navy, FAA training, aircrew training, nuclear power team training, and did an analysis of the different types of techniques that were used and which ones seemed to be most effective. And it was clear that some debriefs sort of got right to the heart of the matter and were very effective, and where the team walked away with a clear idea of what they need to do to improve. And then other debriefs where it felt that the team was just kind of chasing its tail and walked away frustrated, confused, demotivated. And so we wanted to do research on specifically studying how can we make all debriefs more effective. All right, so at the time and really currently still, implementation of debriefing strategies tends to be highly variable, both within programs and industries as well as across programs and industries. In fact, if you watch the same person conducting multiple debriefs, you find that they're even within an individual from day to day, they tend to be conducting the debriefs in a slightly different way. So one of my research goals was to develop a structured process that would help to ensure quality control. So would bring everyone up to a higher level and make that more consistent over time. Secondly, there had been few direct comparisons of debriefing methods and no longitudinal tests. So different organizations and industries tended to have their pet strategies that they liked and had reasons for preferring, but really no data. No one had really done a bake-off, so to speak, to compare multiple methods. So I wanted to conduct empirical tests that directly compared different debriefing methods so we could say once and for all which methods are more effective than others. Okay, debriefing strategies, just like any training method, they're not just one thing. They're made of multiple instructional components. So there's goals, there's the type of feedback, there's the type of facilitation, the structure. All these pieces go into a debriefing method. So even if you compare one method to another and one of them comes out the winner, you're not exactly sure why. What was it about that strategy that was accounting for the performance benefits? And we know that the first thing that happens once you deliver a tested strategy in an operational environment is we're asked, okay, great, what can I strip off of it? How can I make it shorter, quicker, less cumbersome? So if there's research isn't done to parse the unique contribution of the different elements, you run the risk that when other people take your strategy and try to use it, they don't know what's okay to drop or modify and what isn't, and they might accidentally drop something that makes it no longer effective. So I wanted to do research that parsed each of the different components. So we could say, how much does structure matter? How much does facilitation matter, et cetera. All right. Next, there was no research that directly compared the same method in different training contexts. So I wanted to compare the team dimensional training strategy in both ad hoc and intact team training. So what I mean by that, intact team training being teams that are going to later work together, ad hoc teams being those that are perhaps training together but may or may not ever work together in the future, and also in high fidelity simulation and low fidelity simulation. So we wanted to answer the question, can we really change the way people debrief to make them better and to have higher quality control? And does that work across environments, or do we need to change our strategies? So there are a number of unique features that differentiate the various types of team simulation, and I just want to briefly go through them, and I'm sure you have examples in each of these quadrants. So we divide this taxonomy of team simulation into lower high fidelity and ad hoc and intact, and it's dichotomized in this diagram, but it's really a continuum. Now, when you have low fidelity simulation, the objective tends to be to learn task generic team competency. So to understand what it means to be assertive, for example, to understand what it means to be a good leader, but not necessarily in the context of a particular task. So in this case, it could even be a game that the team is going through. It's purely developmental, typically a small team size, and the scenarios are non-technical and are just seen as a means to an end. Okay, on the other hand, the higher the fidelity of the simulation, the more likely it is that it's also being used to evaluate task-specific skills. So they're not just in a developmental environment, but they're also being evaluated, and they may be evaluated not just on team skills, but also on technical skills. So this changes the dynamic a bit. The simulations tend to be longer. They're more realistic. They tend to include larger teams made up of individuals that vary widely in experience sometimes, have very different technical specialties, and as a result, it's difficult to develop an exercise that is equally difficult or equally insightful for everyone on the team. So that situation presents a challenge because you're trying to get the most learning possible across individuals, regardless of where they are on the continuum of experience. All right. Then when we talk about intact versus ad hoc teams, in an intact team environment, the objective is not just to learn generic team skills, but also to learn something about your teammates. So to know, for example, that Dave is highly conscientious, or that I'm highly extroverted, or what our preferences are, what our strengths and what our weaknesses are. And so you're not just learning about the task, but you're learning about each other because you're going to leave that situation and work together again. So you're learning each other's idiosyncrasies. Also, in this type of training environment, the team members have both a history and a future. They have a shared identity, shared goals. So they have a motivation to cooperate, to consider the comments of others, and to be receptive to one another's feedback. This is not necessarily the case when you're training with ad hoc teams. In particular, if you're training in a high-fidelity simulation where you're being evaluated with people that aren't your intact team members, it often turns into a competitive situation where people don't want to admit in mistakes. You have no history, you have no future, you have no shared identity, so you're not necessarily willing to trust and go out on a limb and offer someone feedback, and you might not be as receptive to feedback from them. So each of these different types of training environments have different objectives and different challenges, but what they all have in common is they're typically pre-briefed beforehand and debriefed afterwards. So I'm going to talk now about team dimensional training where it's been studied, and we've studied it in each one of these different types of training situations, what it actually looks like, how it looks different from environment to environment, and how you can implement it yourself. Okay? So, team dimensional training at the highest level is based on the concept of scaffolding. And scaffolding is an instructional strategy where an instructor or teacher or mentor assists a learner in performing a task, but they're giving them as little help as possible. So it's kind of like when you're trying to teach your child to ride a bike. You're hanging on to them tight at first, maybe then with one hand, maybe you're just running alongside them, and then ultimately you let them go on their own. So the learner, you're trying to teach the learner to ask themselves questions that experts ask. So you're teaching them to critique themselves and to self-regulate and develop sort of an expert problem-solving processes and to collaborate with their peers. So this strategy has been shown in educational settings to be effective for one-on-one training and more classroom-based training. And what team dimensional training does is it applies this general notion to the context of team debriefing, and that the facilitator's role is more one in assisting them in self-correcting, that the team is taking the primary role in doing that. So the facilitator is helping them see the forest for the trees. So after especially a long simulation exercise, a lot happens. People may come out of it fatigued, confused, frustrated. They don't really know what they want to talk about, and it's hard for them, having just been deep in the exercise, to get a big picture. So with the debrief, the facilitator in TDT is guiding the team through the process of self-correction. So you may have heard the saying, give a man a fish, he'll eat for a day, teach a man to fish, and he'll eat for a lifetime. With TDT, what we're trying to do is teach a team to fish. So you want the team and the individuals on the team to learn the process of self-correction and to give them a strategy for doing that that is generalizable regardless of what situation they may find themselves in. So it's not specific to a particular type of patient or a particular type of emergency, but it's a strategy they can use to debrief across those situations. The second component of TDT is that the goals are very explicitly process-oriented rather than outcome-oriented. So that's stated right away in the pre-brief, and it's reinforced throughout. So the idea is to improve information flow, workload, things like that, versus taking a performance orientation where the big concern is, did I pass the test? Did I perform better than my teammates, or did we collectively perform better than other teams? So it's to take their emphasis in their mind somewhat off the outcome and get them focused on the processes, because they learn more that way. The third component is that the facilitator there is there to promote what we call a psychologically safe learning climate. So a climate where people feel comfortable admitting mistakes, comfortable providing one another feedback. There's not going to be punishment for that. Okay? And then probably the biggest difference between TDT and other strategies of debriefing is its structure. So I've observed debriefs across a variety of industries and across organizations, and pretty much what we see is there are three very common ways of debriefing. The first way would be the chronological structure, which is you're debriefing kind of start to finish in order of what happened. So a replay of all the events on how they unfolded. Another way of constructing a debrief is to do it structured by position. So dividing up the conversation by person. So anesthesiology, nurses, surgeons, things like that. And then we also see hybrid or free-flowing structures that may incorporate both chronological and position structured, or they're just sort of stream of consciousness. But what we hardly ever see is the structure that TDT uses, and that is to structure the debrief around teamwork processes. So you're going teamwork dimension by teamwork dimension rather than going in the order of the chronology of the exercise. And this is the theoretical reason why. So the structure of the debrief provides an sort of a mental architecture for how you encode lessons learned. So if the debrief is all structured around a particular scenario, then people encode their lessons learned around that scenario. Now, if the sole purpose of the training exercise is to learn that technique in particular, that's okay. But if the idea is that you want people to learn higher level team processes that are generalizable, then you don't want their lessons to be so tied to a particular scenario. You want them to be able to adapt those lessons learned to new situations. A position-structured debrief, what that tends to do is have people encode lessons learned in terms of whose fault it was. So if I'm a nurse, I may only really pay attention or primarily pay attention to the lessons learned that have to do with nursing, and the surgeons may only pay attention to the lessons learned having to do with the surgeons. And what happens is, especially if the team is very fatigued after the exercise, is they kind of tune out when people are talking that aren't specific to their position. And what we find is that when they do that, they miss the opportunity to learn something very valuable that they could glean from what others that are in different technical specialties have experienced. So you're not making the most you can out of the people that are in the debrief. So in contrast, with TDT, we structure it around 4 dimensions of teamwork that we identified back in the 90s as being critical for team effectiveness. Now, you may notice that these are similar but not identical to the TeamSTEPPS skills. They're similar because it's based on the same background research. They're slightly different because the applications of this data in each environment became slightly tweaked so that they are relevant to the specifics of that environment. So the general lesson learned, though, that when you boil teamwork down to distinct categories, 4 seems to be the magic number. And debriefing, if you get above 4 that you're trying to debrief, it's hard for people to really differentiate those lessons in their mind. So with TDT, we structure it around these 4 dimensions, but the same process could be used to debrief the 4 TeamSTEPPS skills. But just to go over the dimensions, the first one is information exchange, and that has to do with searching for information from all available resources, pushing that information to the right people at the right time, and providing big picture summaries. The second dimension we call communication delivery, and that has to do with the style that people use to communicate what they want to say. So are they using standardized protocol, or are they using improper phraseology? Are they ambiguous in their reporting? Are they brief? Are they clear, audible? That's what communication delivery is all about. The third dimension is supporting behavior, and that has to do with actions that team members take to compensate for one another. So pointing out and correcting errors, offering and requesting and being willing to accept backup or assistance when you need it. The fourth dimension is team leadership and followership, and this has to do with offering and seeking suggestions and recommendations, and also providing and requesting directions, priorities, and goals. So those are the 4 dimensions, and the way a TDT debrief goes, these dimensions are the structure of the debrief. So the debrief, the pre-brief begins by telling the team, this strategy is called TDT. How it works is you're going to be asked to critique yourself. So they're told up front, And very specifically, you're going to critique yourself on these 4 dimensions. So here they are. So you define the 4 dimensions, then the team goes through the exercise, and when they're done, the debrief is structured by those dimensions. So then they're asked questions that are on a specific debriefing protocol. So here's some examples for information exchange. The debriefer asks for concrete examples. So give me an example of a time when you or another team member passed relevant information before having to be asked or, in a timely manner. So each of those dimensions and their subcomponents, the team is answering a question by giving a positive example, a negative example, a positive example, a negative example. So they're critiquing themselves on each of the processes, and the processes become the learning objectives, and the scenario itself is just one of many different situations where they could use what they learn, okay? So then the team member would answer something like the blank past the blank to, so-and-so in order to assist them in identifying the emergency prior to or after blank. So basically, the answers, once they're asked these questions over and over again, they get the flow of it, and they get the idea that pretty much in any situation you could take this sentence and plug different players and different pieces of information and different situations into those blanks. But what remains the same, and what we want to be impressed in their minds, is that I should be thinking about passing certain types of information to certain types of people in this type of situation. So the debriefer then asks, how about an example of a time when information was needed but was not provided or was not provided in a timely manner? And then team members throw out examples again, and the debriefer asks follow-up questions like, who could have provided that information? So this is just an example of one category, but it flows like this. It goes through the 3 categories of information exchange, and then the categories within communication delivery, and then supporting behavior and leadership. And so what's different for the debriefers is that they're asking questions, very pointed questions, but questions rather than just giving the answers. So if the team doesn't come up with something that the debriefer thinks is critical, they can add their own input. But they're taught to ask the question first, because it's much better if the team can answer the question themselves. And over time, when the team gets used to this strategy, again, like the father teaching his son how to ride a bike, the debriefer is saying less and less and less until the point where, for very experienced teams, I can lead a debrief effectively, even though I have no idea. I'm not a doctor. I'm not a combat warfare specialist, but I know backup when I hear it. I know information exchange when I hear it, and I can plug their terminology into this framework. So pretty much I'm asking questions and helping them to fit their examples into the categories. And if you have enough experts in the team, the facilitator doesn't have to have all the answers, and that's the beauty of it, especially because sometimes the facilitator was part of the exercise themselves, and they may have made mistakes themselves. So the other thing, so the facilitator has the guide with the questions in front of them to ask, but they're also there, and we train them to do this in a half or full day workshop, how to facilitate once a team member throws an answer out. So inevitably, the team members are going to throw out an answer, something like, well, all the reports I got were useless. And that comment by itself does not teach anybody anything. But in debriefs, you often hear that talked out, and the team may even laugh, chuckle, and say, yes, we need to get better about that, and then move on. And basically, no one has learned anything from that. So the facilitators are taught to ask probing questions like, well, is that because they were improperly phrased? Were they incomplete, too late? In what way would you have liked them to be different? So forcing the team members to state their concerns in a way that the other team members can actually learn from. The debriefer also, because they're, experts in the 4 dimensions, they're also helping the teams to learn the difference between the categories and to tie, bring the forest, see the forest for the trees. So they may get into a long-winded explanation, one of the team members, and then they totally even forget what category they were on or what point they were trying to make. So the facilitator is there to say something like, so in summary, it sounds like you're saying that blank provided you with some good backup by taking on the blank while you were busy with the blank, right? So it's kind of pulling them back in, reining them back into the structure, and then everybody can say, oh, okay, yeah, so everything that person just said, all of that is speaking to the category of backup, and that's an example that I'm going to sort of hang in my memory bank under the category of backup. So then it's easier for them to recall those examples later when they're in a new situation. Okay, so another thing that we teach facilitators to do is how to react when a team member admits a mistake. So I talked about earlier that it's critical for team self-correction to work, that people aren't afraid to admit mistakes. But it's really kind of awkward when someone does that. And I've seen it happen many times, especially if it's maybe a high-status team member that admits a mistake. Everyone else feels uncomfortable about that, and they may try to make light of it. Oh, that wasn't really a big deal. Everything was okay. Or the team wants to pat themselves on the back. And you don't want to do that when someone admits a mistake because you want to learn from the mistake. But at the same time, you don't want to embarrass them and say, oh, yeah, that was ridiculous. How come you did that? Or that really threw the whole exercise off. And so I'm always asked in these training workshops, well, I don't want to reinforce them for doing something bad. So how, what am I supposed to say when they admit a mistake? And I say, you are reinforcing them for catching their mistake, not for making the mistake. So no matter what someone throws out as an example, if it fits the category that I'm asking about, I can always say, great catch, good example, nice self-critique. That's exactly the kind of thing I was looking for in this category. And then give them a chance to correct their mistake by saying, well, if you had to do it again, who would you have passed that information to? So the idea is that, and it really does work, that when you say these things, I know it sounds like, oh, they're going to, I feel funny just throwing out these platitudes, but it really does work. The person, it switches to, I made a good contribution to this debrief. I feel good because I brought something up that was relevant to everyone and not just, oh, I just embarrassed myself in front of everyone. And it becomes a climate where once one person admits a mistake, then other people start admitting mistakes. And then it becomes just normal practice for that team and for that debrief. You also have situations where people will throw out a solution and it's not a good solution. And debriefers always say to me also, well, how am I supposed to reinforce them for giving me a dumb solution? And I say, well, usually there's part of what they said that is reasonable and maybe part of it that's unreasonable. And your job is to try to couch what they said in a way that they still feel like there was something of value in what they said. So, for example, you might say, now in this case, the blank was still working. But if it had not been, then you're right. Opening the blank would have been a great option. So teaching them, well, your idea would work in this other situation, but not in the one you were in today. Or, that's a great point. A clear statement of priorities was needed at that time, but the person who had the authority to do that was actually blank. So you're acknowledging the part of their answer that had some merit, and at the same time correcting the part that didn't, rather than just wholesale rejecting their idea. All right, so what does the research show? This is really exciting to me being a scientist. I've spent a couple of decades collecting data on this strategy, and I've done so in each of these environments. So, for example, low-fidelity simulation with ad hoc teams. I've studied mission controllers in their space flight resource management training, airline pilots in cockpit resource management, and surface warfare officers in a Navy command and control environment. In terms of high-fidelity simulation with ad hoc teams, again, we've done high-fidelity mission control scenario. We've done exercises with law enforcement and correction simulation, and I've also done it in medical environments, specifically CAMELS at USF in Tampa, and also VCU med school. Then in terms of intact teams in high-fidelity situations, this has been used in battle force tactical training where they're actually doing war games in multiple ships out at sea. I've also used this and collected data with submarines in their pre-deployment full-up high-fidelity simulator, and also with nuclear power plant teams in a high-fidelity simulation environment. And then finally, most recently, we've used it in a low-fidelity but intact team situation. Was kind of cool in Wyoming. They take astronaut candidates, send them off into the mountains for a week. So obviously it's low fidelity in the sense that they're not doing anything space flight related, but they're going with team members that they're going to end up on the ISS with. So it's intact team training. And they've used TDT to debrief those situations that occur to them during that week when they're out on the mountain. We've also used it for project team training in using scientists and engineers. Okay, so we've collected a lot of data over a long period of time. What did we find? Well, we found evidence, and this is definitely the most rigorously evaluated debriefing technique that is out there. We've got statistically significant effects on teamwork processes and problem solving in terms of outcomes, safety errors, tactical performance, and also, most recently, a reduction in training time. So that was a study I did for NASA with mission controllers, and they train for weeks or months to get certified on a new position. And we compared TDT to the strategies that they were using already, and we were able to cut the training time, the number of simulations that a mission controller went through in half, which is a huge cost saving for them. All right, so we pretty much found consistent effects, whether we're looking at the team level, so team performance, or at the individual level. So in the ad hoc training environment, performance is evaluated at the level of individuals typically, and the individual mission controllers, even though they trained every day with a different team, they learned faster, they had better problem-solving performance, and they certified faster in both high and low fidelity, in both ad hoc and intact team environments. So what's the mechanism through which this works? Well, TDT affects performance through the knowledge that the team gains. So if you remember with the scaffolding, the goal is for novices to start thinking more like experts and to be asking themselves questions that experts ask themselves. And secondly, by their willingness to actually participate and admit mistakes. So, for example, this slide shows the difference between TDT and teams debriefed with TDT, teams debriefed chronologically, and teams debriefed using a position-specific structure. That the TDT teams, the average number of mistakes admitted per individual is way higher and statistically significant. Mean participation, so this is the average number of times that each person spoke, again, significantly higher with TDT. We also looked at the variability in participation. So part of TDT is that we want not just the two most dominant people in the team to talk, but we want everybody to talk. So this graph shows standard deviation. So in other words, how variable was the participation. So in TDT, there was significantly less variability. So in other words, people were it was more equally distributed who was talking during the debrief. All right. In terms of knowledge, we measured their mental models of teamwork using a card sorting strategy. So we had concrete examples of comments that people would throw out in the debrief, and we asked them to sort these situations into various categories. That was supposed to be animated, but that didn't work. So they sort these, and then they label their piles, and we analyze their mental models to see how closely they are able to match the TDT model versus two competing ways of organizing knowledge that we know are ineffective. The first being outcome-oriented, where people just separate it into good, bad, really bad. And this is the outcome orientation. So we find when we compared the trainees when they started training to after their fourth simulation, that trainees that were debriefed using a chronological style, that's the green line there, their mental models became more and more outcome-oriented. So they were focusing more and more on good, bad, ugly, and less on the underlying processes, which is exactly, what we want, the processes. So they're doing the opposite. The chronological debriefs, people's mental models got worse as a function of training, whereas the TDT trainees, their mental models became less outcome-oriented and more process-oriented. This graph now shows how position-specific their mental models became. So recall that I was saying one of the downsides of a position-specific structure of the debrief is that you will remember the lessons learned associated with positions, and it's like, well, this was pertinent just to this position, but not me. And these things for position, that your lessons learned are by technical specialty. So we see here that the people whose debriefs were position structured, their mental models of teamwork became significantly more position specific by the fourth simulation compared to those who were debriefed in a chronological fashion or using TDT. So basically, these data are showing that, yes, in fact, the way that the debrief is structured determines how people encode new experiences. So this third slide shows how close people's mental models were to the TDT model. So what we see is before training, people were pretty much the same in terms of thinking like TDT. After the fourth sim, the people who had a chronological or position-structured debrief became less TDT-like, and the people who were debriefed using TDT became systematically more likely to organize their knowledge and their inputs to a debrief around the TDT model. And we found that these two factors, the increase in participation, admitting mistakes, talking, and the changes in their knowledge explain statistically why TDT improved learning by 50%. That's the data at the individual level. And secondly, at the team level, we found the same two explanatory variables. So when we looked at team performance, there was a 70% reduction in errors by the third simulation exercise, and the impact of TDT when compared to the control group was through, again, mental models about teamwork and the degree to which people were participating. All right, so I'm going to wrap up here with some takeaways. So I've talked about the data. One of the early questions, and that what I always get asked or told when I go into a new environment is, well, you can't really change how people debrief. It's personality or it's their experience and their expertise, and you can't get them to change their style. Well, we know that this is not true. We know that we were able to control statistically for who the debriefer was in these debriefs, and this came from 66 transcribed debriefs. So when we separate out the impact of who was giving the debrief, the structure of the debrief was more important and actually affected learning. Okay, so we know that we can train people and that they will stick to the strategy as long as they have this debriefing guide. We followed the same debriefers for months after they were taught how to debrief, and they actually got better at using it rather than watering it down. So the strategy itself, guided team self-correction, it's improving both individual and team performance. And the 4 pieces to remember about it is that it's team self-correction, so the team's being asked questions. The goals are process. It's a process focus rather than outcome. That the facilitator's role is to set up a psychologically safe climate, and they do that by the way they respond to inputs and the way they pose questions. And that it's structured around a model of teamwork, be it the TDT 4 dimensions or the TeamSTEPPS 4 dimensions. The idea is that it's structured around teamwork processes. Okay, and fourth, that these findings are robust. So, you saw all the various environments that it's been tested in, regardless of what industry we're in, whether it's ad hoc, intact, high, low fidelity simulation, we keep over and over getting the same findings. And with that, I want to open it up to questions. I stayed pretty well on my time.
You did. Thank you so much. That was really great. That was very, very interesting. Thank you very much for being here for us today.
Sure.
We do have a couple of questions that have come through. First one, more general about the debriefings. Somebody wanted to know how quick do you do debriefings after a specific incident, or what do you recommend?
If you can do it immediately after, that's usually what's best because it's fresh in their minds.
Sure.
If you can't do it immediately after, then if the team is used to the strategy, it's easier for them to the next day recall what happened because they're going to recall it around those categories. We also, if you have observers or instructors that are watching the exercise, they can take notes and organize their notes around the 4 dimensions. So if you have to wait a day or so to debrief it, they have their notes and they can remind the team of certain things that happen. But it's always best to do it closer in time to the actual exercise. The beauty of it is because the team is self-correcting, the instructors don't have to figure everything out prior to starting the debrief. And that's what you see a lot of times is they take an hour, 2 hours to replay the incident and figure out what they want to say to the team. Instead, they're going right to the team, asking questions, and very often they tell me that the team members pointed out things that they totally missed that happened during the exercise, especially if it's a large team.
That makes sense, yeah. When you were talking about the people that when they were reporting the number of errors that they admitted, is there data that addresses the number of errors committed in the teams versus the errors admitted?
I only know that the number of errors admitted in the first debrief is positively correlated with performance on the second debrief and uncorrelated with performance. Okay, let me restate this. So the number of mistakes that are admitted was not correlated with performance on day 1.
Okay.
So it's not that teams that were screwing up had more mistakes to admit, but it was positively correlated with performance at the end of training. So that goes against the idea that they had more mistakes made because they actually got better, although they didn't differ on the first day. But that's a good question. I'm often asked that.
That is, yeah, that's really interesting. It goes to that idea in a lot of quality improvement, too, where people start noticing and bringing more things up as even if things are getting better in an organization.
Right.
So continuing in on this, going back, somebody just asked a question I think is really interesting about, like, how do you actually keep the team from debriefing in that role type model, from sliding into that? This person saying, because, you know, often a physician kind of takes over the debriefing process. I would argue that it's anybody that might feel that they're in the hierarchical position would, you know, take over in that process. So how do you recommend people to stop themselves from slipping into that role debriefing type process?
Right. Well, that's a good question. So I'll answer it in a couple of ways. The first way is usually I talk to or ask the debriefers to talk to those high-ranking people beforehand to tell them, listen, the way this works is, you know, we want everybody to talk. So can you try to let other people talk? In fact, with the submarine teams, we made the captains sit in the back because if they sat in the front, then everyone would watch them and wait for them to talk first. So if they're behind you and they don't jump right in, you can't tell what they're doing back there. And so the captain would say, that's the first time I've ever heard that petty officer's voice. I didn't even know what he sounded like. So you can physically position them to deter that. Also, the debriefer, because of the way you're asking the question, it's not around a particular event, but around a behavior, and you're tying that back to the behavior, that kind of begins to eliminate that, you know, monopolizing the conversation. Also, when you're the facilitator, you're in charge of calling on people. So you can intentionally make sure that you're not, you know, letting the same person answer every single question. So it's a combination of things. It's prepping the high-status person, positioning the room in a certain way, and facilitating the questions in a certain way. But I have seen it work to where captains, very forceful captains, have said, you know what, I like this, and seeing is believing, and I'm going to shut up because I like the information that I'm getting from my teammates.
I think it's interesting. I've never thought of just that simple positioning of people physically. That would even help provide some psychological safety for folks that might feel uncomfortable in disagreeing even because they're not sitting there with that person staring right at them from the front.
Exactly. And also, if you put the low-ranking people in front and in the center, just by virtue of their position, they're going to get more of your eye contact because we just tend to look in the middle. So people who are reluctant to speak up, if you don't look them in the eye deliberately, and when I'm teaching class, it's the same thing. When you look at them in the eye, it's like you're taking a key and opening the safe, right?
Yeah.
And so if they're sitting straight in front of you, you're going to look at them more, and that's going to increase the likelihood that they speak up.
Very interesting. Well, Kim, we have a lot of questions that are still in the queue. We're at the top of the hour, so I'm going to thank you right now for the webinar, and we'll touch base. For all those that didn't have their questions answered, we're going to touch base with Kim and come up with some answers to those questions for you, and we will be posting them on the TeamSTEPPS portal, so please check there in a few days. But thank you very much, Kim, for your presentation. Incredibly interesting, and just looking at the comments coming in, people seem to be very happy with what they heard as well. So thanks for being with us today.
Well, great. Thanks for inviting me.
Thank you very much. Ladies and gentlemen, this conference is now concluded. You may disconnect your phone lines, and have a great rest of the week.